Hello students, we're here to talk about peds in Des Moines, and we all kind of have a little bit of a different perspective. I'm Marcella, I'm a third year medical student. All of my colleagues here are also third year medical students. I'll let them introduce themselves.
I'm Darren.
And I'm Mike.
And so we'll kind of just give a brief kind of synopsis of what our experience was like here specifically. So we'll have Mike want to start.
Okay, I went into peds not thinking I was going to do peds at all, and so I kind of just hate kids, I guess. But no, I mean, I went in and I had that negative perspective, and I love peds here. Dr. Robis, who's the head of the program here, is excellent. He's really super nice. You get to know him right off the bat, and he's willing to help you basically in any way he possibly can. Gets you all the food cards you could possibly eat. So you're allowed a lot of funds for your food, so you don't really need to go to restaurants. And then on the peds unit itself, you get inpatient versus outpatient. Your inpatient time, you spend a lot of time on the floor, get a lot of time with the kids. I played Call of Duty with a kid with leukemia one afternoon. Had to let him beat me, but I played it with him. And then on the outpatient side, you do get some opportunities for procedures, particularly lumbar punctures on some kids receiving intrathecal chemo. So you get a lot of opportunities here that I don't think I've heard from my classmates in Iowa City.
I'll just talk about maybe not so many duties pertaining to what we're actually supposed to do in the hospital, but they do encourage you to go out to the wards if you're not doing paperwork or something. And I had a pretty good time just chatting with my patients, drew some pretty flawless Snow Whites, and got my singing down, got the ABC song down, and pretty good stuff like that. And then also the attendings here are pretty top notch. I guess I haven't done anything in Iowa City, but as far as the people that I worked with here, I can't imagine they would be any better anywhere else. So let Marcella go ahead and finish off.
I just have to we were on the inpatient service together, so I just have to reinforce how awesome it is that you do get to spend inpatient time, because I would be writing my notes right side of his room and hearing them singing little songs. Call Me Maybe was his personal favorite with this patient.
I didn't bring Call Me Maybe.
He totally brought the Call Me Maybe. But it was really fun, and he's right about the attendings. You get a lot of time. I think we had on inpatient one for 2 weeks and one for 1 week. So when you get evaluated from the inpatient side, you feel like they really got to spend a good amount of time with you. Same with the residents. They split everybody into 2 groups. So when you rotate in the morning for rounds, there's a lot of opportunities to round, so a lot of opportunities to present. You feel like you really got to practice that skill. You only do it, I think, with ours, it was maybe 3 residents, so like 1 senior, 2 interns. Most of the time it was just me as a med student, and then like social work and kind of pharmacy people who help out. But the point is, like, as a med student, you're like the only one, or maybe one of 2. And then residents are pretty small, so when it's your patient, you actually get to present. They don't give you a tremendous amount of patient load at first, but they give you a lot of opportunities to add more patients later, so you feel like you really challenged yourself in terms of what you were able to take on and learn. I'm trying to think of other amazing parts. Blink itself is really cute. They designed it so the person who, I believe, a head of Disney or an artist at Disney, they have a lot of money from the Disney folks. I don't remember exactly who. But the point is that the whole hospital itself, the Blink Children's Center, is really cute, decorated, and like the playrooms are really adorable, and the walls are all painted. So when you're there, you just feel like you're having a lot of fun. The nurses are very fun and wear colorful scrubs. So it just keeps you happy even if you're doing those long days on the floors. The outpatient side, I can't imagine it being that much different to Iowa. You get a lot of variety. You get to bounce around between a lot of doctors. You have a high volume practices, so you've never seen more tympanic membranes in your life. You get to be really hands-on, see patients on your own. I also got to do some lumbar punctures on the cancer patients, which we were just talking about before. This is a great way to practice the lumbar puncture, because you don't get that many opportunities to kind of do invasive procedures on your own. But unlike adults, these kids are sedated, so you don't have to worry about squirming. They're thin, you can palpate. So it's a great way to practice, and they are pretty, they like offer it to you. You don't have to sit there and like beg to do procedures. But I mean, I think you had a little bit of a different experience too. So it does vary, as any rotation does, but I think here, more than my classmates in Iowa City, I felt like I got to do a lot more hands-on stuff. Anything else that you guys would add?
Just want to reinforce that the Call Me Maybe was not my choice, it was a patient's
Totally
choice.
his choice. But nevertheless, hope you guys enjoy your PEDS rotations here next year if you choose to do it, and see you later.
Bye.